Hey, how's it going? Are you have wrist pain? Is something here hurt? Have you been told maybe you have carpal tunnel syndrome, or even gone to Dr. Google and looked it up and been like, oh, I've got carpal tunnel syndrome? Well, you know what? It may or may not be carpal tunnel syndrome. And you are not your diagnosis, and this is exactly what you need to know before you ever consider the carpal tunnel release surgery. My name is Dr. Aaron LeBauer from Greensboro, North Carolina.
My name is Dr. Nielsen, Kaizen Physical Therapy.
And we're both doctors of physical therapy and here to talk to you about carpal tunnel syndrome, how to know if you really have it and whether you should choose the surgery or what you should do instead.
Yeah, so there's multiple reasons that you could be having carpal tunnel symptoms. So traditionally that's some sort of tingling down into the hand, but there's multiple causes. So a lot of things that you want to think about is what is your age? Number one, because if you're somebody younger and you're having carpal tunnel, it's probably not traditional carpal tunnel. Or if possibly you don't have the desk job and you're not sitting here typing all day, you probably don't have it either. Sometimes it's coming from, and even if you do, you're older and you have the desk job, because I know Dr. LeBauer was going to say that, that you probably don't have it either. This is something we see a lot of times in the clinic, that people come in and say, I've been diagnosed with carpal tunnel. And in reality, it's not carpal tunnel, even though it presents like it, the symptoms.
So what is carpal tunnel? There's a little channel right here in your wrist where some nerves and tendons glide. That's the carpal tunnel. And carpal tunnel syndrome is just a name for a group of signs and symptoms of pain in this area. Technically, it would be a compression of the nerve, the median nerve that runs through here, and there's no need for alarm, because most people who have pain here or pain in their hand or wrist that say they've got carpal tunnel usually have a shoulder problem that we can reproduce in the clinic by pressing on their shoulder and nowhere close to their arm or hand. So typically, how does this present for you?
How does it presents, like you had said, typically it presents with some sort of tingling down into the hand. It usually gets worse with some sort of shoulder movement, because again, like Dr. LeBauer said, it's usually coming from the shoulder. It can also be coming from the neck. But the far majority of the time, it's not a problem in the wrist, even though that's where the symptoms are.
Right. So if you have carpal tunnel syndrome or pain in your wrist and it's resolving and getting better, great. But if you've had it or you're concerned that you have it, or you've had it and it's not getting better, likelihood it's not just a problem here, there's a problem in your arm, your shoulder, your neck, or even upper back. So what we do is we take all our patients who have carpal tunnel syndrome, or let's say they got an ankle problem, foot problem, elbow problem, we take them through a full body diagnostic exam where we can see how your whole body moves. Because we are experts in movement, injury, and recovery from injury, and helping people live full, active, healthy lives. And what you need is not just to focus on where the pain hurts, because that's just kind of the signal that there's a problem. You need someone who can look at the other areas of your body that are close by or interact with the area that hurts. So if someone's having a problem, what can they do about it right now?
Yeah, so go ahead and look for the link around this video and jump on the phone with us, either myself or Dr. LeBauer. Get on the phone and let's talk a little bit more about what's going on, what your symptoms are like, what you've tried, what your past medical history is. And then if we deem that you a right fit for us and we feel like we'd be a right fit for you, come into the clinic for a free visit. And like Dr. LeBauer said, a full body diagnostic will assess how everything's moving, what exactly is going on, and then we'll get to the bottom of your problem.
Yep, and we'll give you a roadmap to success and getting back to the activities you'd rather be doing. All you gotta do, click the link below, let's get on the phone, and remember, you are not your diagnosis, you are an amazing, strong, mobile human being, and there's so many options out there for you, and I hope you'd allow us to give you at least a second opinion about what you can do and what's possible for you before you go down the road and get more injections and surgery, because we'd rather see you on this end of that than years later like we've seen too many people. So our goal is to save people from unnecessary surgery and expensive imaging and results, and we would love the opportunity to speak with you, to talk about what's going on. So we'll talk to you soon. Have a great day.